talk about medication adherence. This is something that insurance companies are grading us on, how well our patients adhere to the medications, particularly on the ambulatory side. How does DrFirst fit into this? Why is this important? And what can health systems and providers do to improve those rates?
I think DrFirst is uniquely positioned because we have the front end and the back end of the adherence challenge. Why it's important is very similar to what we just talked about in MedRec, which is it's great to get the med list correct, or it's great to give them the right prescriptions out the door, but if they never fill them, they're going to end right back up in the ER. They're going to end up with a really poor outcome. On the front end, the way DrFirst fits in and the way the industry is moving is what I would call a mobile patient engagement. With COVID, we saw a real uptick in patients engaging in things like portals or telehealth. And we, as an industry, felt the need to meet the patient where they are, as opposed to saying, you need to come to us and we'll do it all in brick and mortar. And one of the things that we're able to do, at least with DrFirst on the front end, is post-prescription, we're able to engage the patient through SMS messaging. The literature shows that patients look at SMS over 90% of the time. It's not something that gets ignored. And in fact, our own numbers will show that patients engage. But what we do with adherence post-prescription event is we will provide them an SMS that gives them a unique, almost an app-like experience. And that experience shows you things like education, copay, where did the prescription get sent? Because if you think back to the paper days, there was something tangible the patient had, and now that's gone, and we're giving that back digitally. But the most important thing that we do with the solution, and it's called RX Inform, is that when it's possible, we will match patients up with copay assistance options, whether that's pharma, whether that's coupons, etc.